All right, welcome, Dr. Leigh Erin Connealy. I am so happy to have you on this interview. I met Dr. Connealy a couple of years ago when I got to host her on a women's wellness podcast, and I'm just so honored to have you here with me again.
Thank you for having me.
Yes, so I want to give just a brief introduction and then we're going to get right to it. So Dr. Leigh Erin Connealy is a prominent leader in the integrative and functional medicine field with over 30 years experience. She takes the best of all sciences, including homeopathic and conventional treatments for cancer, chronic illness, nutrition, and lifestyle approach. She's the medical director of two amazing clinics in Irvine, California, the Center for New Medicine and the Cancer Center for Healing, which combined, these clinics are the largest integrative medical clinic in North America and are visited by patients from all over the world with 47,000 patients and growing. What I love about Dr. Connealy's approach is she's interested in treating the whole person, not the patient with the disease, or she treats the patient with the disease, not the disease in the patient, which is so important. She's created an acute awareness for the need to focus on cancer prevention, providing unique testing to determine the early stages of cancer, often years before a scan reveals it or it's recognized. So such impressive information. Again, I was just absolutely blown away when I got to come and tour your centers a couple years ago. Right away, I felt a huge sense of love and compassion, which is so important in healing. And then just your guys, the center is so impressive on its own, the tools that you have, the space that you have, the practitioners that you have working there. So thank you for doing what you do. We certainly need more clinics like this.
Yes.
So let's, I would love to hear from you. So can you tell our viewers a little bit more about your incredible centers in Southern California?
All right. Well, people always, when they come here, because it's a large facility, they always say, well, like, how did this start? And I said, well, I started with a teeny tiny little office. And over the years, I have grown this facility. And so everything starts, like, you know, the saying is a marathon starts with one step. So everything started very small, very slowly. And then back when I was starting medicine, there wasn't the awareness of integrative functional medicine like there is today. Not that there's an abundance of it, but it is definitely becoming in the forefront of people's lives. And they're realizing that there are just not medications for a lot of medical problems. And so, you know, the conventional drug, you know, disease drug paradigm doesn't fit a lot of diseases like autism and Alzheimer's and autoimmune and all the whole list of things. Most of the times, medications have a very limited return. So we have to now really delve into the body, how it works, and we understand that with the functional integrative approach. So fortunately, with the growth of more functional medicine doctors, you know, and the need, this practice has grown. One of my personal passions, because I have a lot, is in prevention, early detection of cancer. Because, you know, cancer is 1 in 2 people and it's growing exponentially. And we see younger and younger people now just appear at 35 with stage 4 cancer. So we have so much health opportunity to prevent all diseases, not just cancer. And that's where our focus needs to be, is not on the sickness, illness industry, but on the preventative, proactive, personalized approach to medicine. And so this has to change because, you know, our job is to really resurrect humanity and give them the best life possible, because with that, we have happy people, happy families, happy communities.
Absolutely. And healthy. Yeah. And I imagine a lot of the tools and things that you use as far as, you know, natural treatment of cancer would be similar things that you would end up using in prevention. So it's so good for us to all just step into this lifestyle right away, especially as you say, it's 1 in 2 these days. So I know one of the things that you guys have over there is really impressive hyperbaric oxygen therapy center. And so I would love to know, what are some of your protocols that you're using as far as prevention in your clients and patients?
Well, hyperbaric oxygen, believe it or not, is used all over the world. Probably the least, unfortunately, in the United States, but that is changing because the studies and the scientific validation now of hyperbaric oxygen, the most recent study out of Israel came out that, that hyperbaric is incredibly anti-aging and increasing production of stem cells. Obviously, there's so many other factors. It's an anti-inflammatory. It produces new blood vessels. It helps any kind of injured tissue get better. It helps in stroke, autism, anaerobic infections because those kind of bacteria, they don't like oxygen. They don't thrive in oxygen. Yes, there are radiation burns. When people have radiation burns, hyperbaric is really good. I use it for all of my patients pre-surgically. The healing that takes place in a patient who has to have surgery, whether it's facial, plastic surgery, or if it is breast surgery or cancer surgery, orthopedic surgery, any kind of surgery, you will save yourself a lot of time and aggravation and incredible healing if you would do hyperbaric a couple weeks before the surgery and after the surgery. I always tell the plastic surgeons, you're going to look great because the hyperbaric creates this regenerative potential in the body and accelerates healing. I personally have used lots of hyperbaric. I had bunion surgery, so I used hyperbaric, but most recently, last year, I had 18 hours of back surgery. I was in the hyperbaric after the surgery a ton. And that's how I got better and got back to work so much quicker. And so hyperbaric is, I tell people the number one thing you need to live and survive is oxygen. Unfortunately, the FDA labels oxygen as a drug. It's actually a nutrient that your body needs for every single cell, the trillions of cells in your body, to function. So we can't live without oxygen, and every disease process is related to your oxygenation. Let's take something simple as anemia. It's amazing how many patients, they come in with anemia. Maybe it's because they have serious period loss, or they have cancer. A lot of cancer patients have anemia. Well, what happens when you are anemic? So what delivers oxygen to your tissues? Your red blood cells. So your red blood cells carry oxygen. They also carry all the nutrients. So if you have decreased red blood cells, decreased hemoglobin, you have decreased oxygen going to all your tissues. So you're setting up your body for a disease worse than the anemia. So I always tell the patient, this isn't just a simple little process of taking iron. This is that you're not oxygenating your tissue, which has relationship with every diseases. For example, in stroke, what happens is it's decreased in oxygen. If you put a patient right away after a stroke, you dramatically reduce their recovery time. If a patient has a cardiac arrest, or they decrease the injury to the heart tissue. So there isn't any disease process that oxygen is not going to help. Look at wound healing or diabetic ulcers. And in cancer, so Otto Warburg, 1933, won the Nobel Prize that cancer is acidic, low oxygen, and sugary environment. So, and they go, well, patients go, well, I checked my pulse ox. And I said, well, that's one thing. It's the tissue oxygen. So hyperbaric oxygen floods your body and helps the body get the oxygen to the tissue that doesn't have it. So this is very, very important. In fact, in 2019, I think there were 3 Nobel Prize winners that discovered something called hypoxia-inducible factor. So that is your body's mechanism to adjust to the different oxygenation in your tissues. So I do a blood test on a lot of my patients with cancer called PHI. It's the enzyme of hypoxia. So let's say you have Hodgkin's lymphoma, for example, And yes, chemotherapy works great for that particular cancer. So I will draw a PHI, it's a fasting blood test. And if the patient has a very high level, you may do the chemotherapy, but if you do not change the terrain of the body, you will, that chemotherapy basically is just going to be a Band-Aid, but if the condition isn't changed, the cancer comes right back. So I tell people, you know, people think we have drive-through, instantaneous mail order treatments for disease. Trust me, there is no such thing. If it's too good to be true, it is. And people don't understand that health is a process, not an event. And it's not like something you just pop a bill and you're fine, okay? I've never seen it. I'm 63. I've never seen that kind of thing in my life. I have 5 children. I've never seen it, okay? So don't look for instantaneous anything because it does not exist. It's the methodology is the discipline every single day of taking care of your health. And because people always want to know, how did I get into this mess? And I'm like, well, it's many years, whether it's heart disease, cancer, it takes years to develop these diseases. That's why I tell people the pain of discipline is far better than the tons of regret.
Love it. Oh my gosh. So much good information. You're clearly super passionate about what you're doing.
Well, I do, because this is the problem, is we are seeing now that they don't want you to know this information. And all of this information is vital. And I did not learn this just all at once. I learned it over time by treating myself. I tell people I'm not just a doctor, I'm a patient. Mm-hmm. Number one. Number two, I have treated patients for 34 years. So you learn something, okay? And I want patients, and I know you do too, that's why we're doing this, is you want patients to know what we know, whether it's about hyperbaric oxygen, whether it's about nutrition, whether it's about purifications, whatever. I want to give patients their life back. And it isn't complicated to do, all right, unless someone comes to me very, very, very broken and destroyed. But I always can give them uplifting treatments and things to do to live today great. And that's what it is. I might not be able to allow them to live because some of these patients come to me way after the fact. When you get a diagnosis, you should make it your business to start researching everything you can on the topic. Don't take one doctor's advice because, you know, how could I know everything? How could you know everything? How could any medical doctor or other doctors know everything? But we all have our intuition and gut. And if something doesn't sound right or doesn't feel right, we shouldn't be doing it. So a lot of patients just kind of go, okay, yeah, my doctor told me. For example, I had a patient come in, fireman, retired. He has a genetic condition called polycystic kidney disease. So he comes to see me and his numbers on his kidney function are deplorable. And I'm like, so what did your doctors do before me? And he goes, well, I went to nephrologist, 3 different nephrologists every 6 months. And I said, what did they do? He goes, nothing. And I go, well, that's not the right approach. I said, we need to be resurrecting your kidney. We shouldn't be looking at your numbers to wait until you get to dialysis, because dialysis just accelerates your decline process. And so he goes, I know, but I just was going to the doctor and there are experts and that's what they do. So I always tell patients, look for a doctor who is looking at every detail of your situation. And if they don't have very proactive, personalized solutions, you probably need to go look elsewhere. Because if they're just watching the numbers get worse, that means what are they doing for you, right? So we should have a very detailed plan when we go to the physician, because we know now how the body works, okay? It may not be yet in books yet to teach in medical schools, but we have it in integrative medicine, functional medicine conferences. We have it in the latest, greatest meetings. And the information's out there. Thank God for your cell phone. You can find a plethora of information, but keep looking, keep searching for answers, because that's how we're all together going to change the world.
Absolutely, 100%. You know, right now in our country, it's not necessarily easy to, well, it is easy, but these tools in the way of looking at the body, the way that integrative practitioners do, is not necessarily just something that's going to get thrown at you. You've got to seek it out because of the medical system and the way medical schools are still taught in our country. But like you said, we're learning so much more about the body, and it's not about treating the end organ, it's about treating the person. And so, you know, I'm hopeful that we're hitting that tipping point of that being, you know, patients are wanting more. I think patients are seeking out more integrative care because they don't want to just take a drug to mask the symptoms of their kidney disease. They want to know why. What am I doing wrong? What did I do that took years to get to this place? And how can I start to undo it in other ways than just taking the medicine? So yes, I love that approach, and absolutely all the information is out there. You've just got to seek it out. The books, the YouTube for now, other resources on the internet are so fantastic. So, you know, just going back, you mentioned so many incredible things when we were talking about your tools, and, you know, oxygen is a nutrient, which I love. We look at it that way as well. And it's one of the most healing nutrients of the body. And so, you know, just getting back to that, when talking about the whole person, I would love to know, in your medical opinion, what are some of the things that you see that oxygen, or hyperbaric oxygen specifically, does in ways to impact people's health that maybe some of the other tools don't do as well? I do think we need the stack approach, meaning there's not one tool that cures all. I do happen to think that, you know, with nutrition and lifestyle, hyperbaric is a pretty heavy hitter. I think it gives people a lot of push in the right direction. And so, you know, I know you have a lot of tools, so I'd be curious your thoughts on that.
Right. Well, we do have a lot of tools, just like you said. Like if you have an earthquake in your body, and that's what I always kind of use the analogy of any disease, whether it's cancer, a stroke, a heart attack. The top two killers are heart disease and cancer. So, but every disease process takes a very, very multi-pronged, multifaceted approach. So you can't go home and eat cupcakes and Cheerios and hamburger helper to get well. You know, the single greatest determinant of health is what you put on your fork. So we got to learn. I always tell people, like, your energy comes from that every single bite. Okay. So every single morsel needs to count, because that's how your body has glucose and fatty acids and proteins and things for the mitochondria to work. So the mitochondria are the powerhouse engines of the cell that make you work every day. And as we age, those mitochondria destruction goes down, and the need for us to do things better. The other thing is that probably one of the greatest things everyone can do is cleanse, because I've read 3 reports in the last 6 months that 5 to 9 people die of pollution. Okay, so that should tell you right now that we need to be all cleansing. They found in the placentas of babies and umbilical cords and breast milk and everything, hundreds and hundreds of chemicals. What they do in each person is unique, and we don't know what the unique capability of everything is, of every patient is. So we have to just have every patient on it. I would tell people that you need to cleanse in some way every single day. So if you don't do these foundational rules of the body, and I tell people there are natural laws and rules of the body that we all have to abide by. If we don't, we're going to pay a price. It's just the way it is. For example, if you do not sleep well, then you're going to pay a very serious price, okay? Just sleeping. And that's something you're on your own doing. And 50% of the population today has a sleep disorder. So just that alone, not to mention all the other lifestyle interventions. But specific treatments here, so we do everything, like we talked about hyperbaric. So hyperbaric specifically, we use for a variety, like I told you, pre-surgically. I use it on all the cancer patients, and the reason is they're injured. When you have cancer, you're injured. Think about it. You have inflammation, you're injured, you're hypoxic, which is low oxygen, you're acidic, your cells aren't taking care of you. So you need oxygenation for the whole general state of the body. Number two, like if you have an injury, if you have a break a bone, hyperbaric oxygen accelerates that healing. Like I said, pre-surgically, post-surgically, highly recommend it. If you want to do it for anti-aging, it stimulates the stem cells of the body. Hyperbaric oxygen influences thousands of genes to take care of you. It induces apoptosis, programmed cancer cell death. Neurologically, phenomenal, okay? If people have stroke, traumatic brain injury, phenomenal. If we want to create healthy tissue from a diabetic ulcer or any kind of severe wound, like let's just say maybe a motor vehicle accident, dramatic changes in using hyperbaric oxygen. You need to use intensity of it. You know, sometimes I put patients 3 days a week. Sometimes if it's an acute situation, 5 days a week, we need to do hyperbaric. So it's anti-inflammatory. Well, unfortunately, lots of people have inflammation. There's a blood test called C-reactive protein, which is the non-specific marker for inflammation that tells you if you're inflamed. I will tell you that I do that on every single person, whether you're young or old, and lots of people have inflammation. They just don't know it. So in the conventional medical paradigm, there is no drug for inflammation. The drug is change your eating and take omegas, all right? So omegas, you know, essential fatty acids. So you can take a fish or a vegetarian form. So that's the problem, the deficiency in conventional medicine is it doesn't answer all the questions and all the diagnoses that a patient has. So we must combine the conventional, which I love because it tells me incredible information, the blood tests, the scans, all these things tell me great information, but the treatment protocol. So besides hyperbaric, we do specific intravenous combinations of all kinds. We have like 50 to 100 different kinds of IVs. It might be for pain, natural treatment for pain. It might be for your mood. It may be specific anti-cancer, like using DCA and poly-MBA. It could be things to repair your brain, like certain peptides. It might be ultraviolet blood irradiation with ozone. So ultraviolet blood irradiation has been around for years and years to kill infections. Well, who doesn't have chronic infections? We all did. If you had chickenpox, if you have, all of us have been exposed to Epstein-Barr, cytomegalo. Some of the serious infections are like Lyme disease. So we have different protocols for different diseases. But chronic infection, unfortunately, for some people is an issue. Then the other things is I use pulsed electromagnetic field. We know that when we have diseased tissue, the tissue is resonating at a low voltage potential. So the PMF raises the electric potential of the body, so it takes care of itself. Your body is designed to regenerate and rejuvenate, just getting it to the right direction. So all these tools will do it. We have something called endolaser. Endolaser is using 5 different wavelengths of light with photosynthesizers. Photosynthesizers are given first. They activate the diseased tissue you're trying to treat, whether it's cancer, whether it's infections, or other things. And the photosynthesizer activates it. Then the endolaser goes in and zaps the diseased tissue. It is very beautiful treatment, non-injurious, non-harmful. We also do ozone. We do IV ozone. Ozone has been used all over the world. Lots of studies on this. Ozone is super oxygen. It's used intravenous. It's used in the vagina. It's used in the rectum. It's used many different. I've used it in the bladder, and that helps neutralize chemicals that deactivates bug, oxygenates the tissue, and helps the immune system, just like very similar to hyperbaric oxygen. Hyperbaric oxygen is different than ozone, though. We don't want to confuse. So we would use those together as a joint treatment. Then I use red light bed. I love the red light bed personally myself. I haven't been in there for a month or so because I've been too busy, but I always, try. So there isn't any condition that the red light bed. We have a red light bed from Germany. It's 50,000 lights. If you were to buy something online, it may have something up to 100 to 1,000. So this is 50,000, and it has you're doing anteriorly on your chest and on your back. You lay like in a tanning bed. And so that helps resuscitate the mitochondria. The mitochondria, that's what keeps you alive and gives you your currency of life. So red light activates. So there isn't anything from hair growth to brain function, heart function, skin function, kidney function. There isn't a function of the body, healing, joint function, anti-inflammatory. So, we combine these treatments. Obviously eating, we put people on fast or modified fast or intermittent fasting. We do all kinds of different, depending on the condition. There is no one size fits all. Everybody is unique and different in their condition. But I do know that once all these patients start these treatment, within 4 weeks, they feel dramatically better. And in a couple of months, they go, Dr. Connealy, I haven't felt this, they're stage 4 cancer. I haven't felt this good in 25 years. So we can make the patient, I always tell patients, our goal is to get in checkmate with cancer, because unfortunately, a lot of my patients come to me late. We are not focusing on preventive, proactive medicine. We have got to get there, because everybody, first of all, the cost of healthcare will dramatically decrease if we all take responsibility and decide that we want to be healthy. And that is if you don't have, one thing I've learned is if you don't have your health, you have nothing, and everything is compromised. You're compromised, your loved ones are compromised, society is compromised, your relationships are compromised because you're ill. And I know, because I am a living example of someone who has had health challenges due to a drug my mother took when she was pregnant. So I know what it's like to have health challenges. But I will tell you, I'm 63. I take no medications, but I do practice all of these treatments. I take intensive care of myself because I don't want to be burdened to myself. I want to continue practicing till I'm 120. And I want the world to be different than it is now, because 50% of the population right now is chronically ill. How can that be? We can send people to the moon. We can drive automated cars, and trucks now are automated without a driver, but we can't get people well, and we're getting people sicker daily. How is that possible? Because we're not focusing health as our number one value. And that's what we all need to do.
So true. Well, you will keep practicing till 120. You can tell, like I said, you love what you do. You're passionate about it. And look at all the incredible tools, not only that you offer your patients, but that, as you said, you use yourself. So thank God you will be here for all of us for a long time and kicking butt in the health field. Well, it's been incredible to have you here. I want to share a couple resources. Dr. Connealy has 2 incredible books. Your other one, unfortunately, is at my other office. But we've got the Be Perfectly Healthy and the Cancer Revolution. And both of my books of yours are just book tabs. These are incredible, incredible resources. This is the kind of book that you can pick up and skip around and look for exactly what you need in each one. This is more of, I don't even want to say more preventative, because I think they're both preventative, right?
Yeah, right. Well, this is kind of encapsulates everything. It says cancer, but if you had Alzheimer's, this book would be great. Okay, if you had autoimmune, this book would be great. So, because it touches on every facet of living every day. And then when the cancer department, it talks about specific things regarding cancer. But with the cancer rates, 1 out of 2 people, it would behoove anyone to read that just for learning how to live.
Yeah, absolutely. So those are available on Amazon. We'll make sure the links are below the video. And Dr. Connealy, thank you so much again for your time. I know you are a very busy woman, and so we appreciate you coming on today.
Well, thank you for allowing me to share all of our missions.
Of course, thank you.